about when do you need to do a scan for your back pain. So be it an MRI scan or X-ray or a CT scan. So before we go into the answer for this, let's look into what are these scans. So for those of you who don't know me, my name is Swati. I'm a physiotherapist, and I do these live videos to bring awareness to people about common conditions, um, about the common conditions and how they can tackle it, just to bring about awareness and patient education. Now, if you're watching me on the live, please say hello so I know you're here. If you are on the replay, please comment #replay so I know you've been here. So yeah, moving on. So let's look at X-rays, right? So these are basically electromagnetic waves. These are basically electromagnetic waves, yeah? So they take a picture of inside your body, but it's in two-dimensional. So if you look at an X-ray, you can just see what's happening in a front view and a side view, known as an AP and a lateral view. So what happens is the electromagnetic waves are going in. So suppose I'm taking an X-ray of my hand, right? So when it hits the bone, the calcium in the bone, it'll absorb all the X-rays. So it'll turn out to be white. But the tissue or the muscle in there, that'll be light gray because it doesn't quite absorb the X-rays fully. But if suppose I'm taking a chest X-ray, so you've got air inside your lungs, right? So those areas will be black because the air does not absorb your X-rays. Okay, so that's why they reflect different colors on the X-ray, so you can see like the bones are white, the air is black, and the organs are sort of between gray. Yeah, so that's about the X-ray. I'm not going in much detail because they're quite common. Most of people know about them. For CT scans and MRIs, let's look at MRIs first. So that's magnetic resonance imaging. So basically, they're using very strong magnetic fields, and they're also using radio waves. Now, this does not have the electromagnetic waves that X-ray has, so basically less chances of radiation, right? So I'm just looking at my notes here. So yeah, many people have a problem that they feel very claustrophobic when they go into that tunnel where you do an MRI. So basically with an MRI, what happens is you have this tunnel and you lie down and you have to be still. It is loud in there because of the generation of those magnetic fields, right? So the magnets, the very strong magnets that are moving inside the tunnel that create that image. So that's quite noisy. So they give you earmuffs or earplugs to wear. But some people can be quite claustrophobic because it's a tunnel that you're going into. So there are other types of MRIs where, suppose I'm getting my knee MRI done, right? So they'll put only my lower part of the body in, or my hip. So if you're doing the spine, usually the doctor will tell you to go into like the full body goes inside the tunnel. However, some people, because they just can't take that claustrophobic feeling and they cannot do an MRI. So better than not doing an MRI, the doctor will go tell you to do an open tunnel MRI. The thing to note is with this, the doctors are not very keen from what I've seen, because the results, the images that come up from the open tunnel MRI are not so clear. Right. Another type of MRI that people do, this can be done with CT scans as well, is a contrast dye. So they inject a dye, like a color, into, like they give you an injection into your arm and it'll go into your blood vessel. So that is to enhance or to show up a specific part more. So this is more to do with when you're looking at blood supply or how much blood flow is going to a certain organ, say your kidneys or your like whatever, liver. So usually contrast dye will be used for that. But they cannot use contrast dye for people who are allergic to them, which is not a very high percentage, and people who are pregnant. So yeah, so that was about the contrast dye. Oh yeah, it's also used for tumors. If you're going to look for like visibility of the tumors, they use a contrast dye. What else? Oh yeah, and another thing patients don't like about MRIs is they cannot move once they're in the tunnel, because once you move, it's like taking a picture. You blur the images, then they have to start all over again. So one practical tip that I give to my patients is, keep breathing. Don't hold yourself so stiff. For example, if I'm going in for the spine, they'll tell me to be in a position like this. So don't squeeze yourself like this and go all stiff, So just hold yourself there and just gently and calmly just hold yourself in one position, which of course is difficult, but something's got to be done, right? So you have to do it. Might as well do it the right way. What else? Yeah, okay. So basically, they are three-dimensional pictures, unlike an X-ray. And the CT scans are more for, it's similar to MRI. Again, you go into a tunnel, but they're quieter. And CT scans are done more for when you're looking at organs or tumors or sorry, CT scan is also called computerized axial tomography, in case you want to know. So it's done more for organs, head injuries, brain scans, tumors. Somebody who's had a stroke or has Parkinson's, then you want to scan their brain. So CT scans are more for that, and MRIs are something that we deal with every day. So that's something that's done for like fractures, ligaments, more bone and disc issues. So MRIs are quite commonly done. Now, let's come to the practical part. A patient comes in and asks me on the first visit, do I need to get an MRI done? My doctor said, get it done. Now, if my patient is very acute, has extreme radiation going down the legs from nerve compression, or they are at a place where they are so weak that they are just short of paralysis, of course, the doctor will have already done the MRI. If not, then we'll tell them, okay, go get the MRI done. So, because you don't want to mess around with the spine of such a patient, right? You want to know exactly what's going on. However, when a regular back pain patient comes in, I would tell them, wait for a session or 2 or 3, do your exercises, take all the precautions I'm telling you to, and then if you still don't improve, I'll ask you to go and get an MRI done. Or probably I'll ask you to go to your doctor and get some medication. If it still doesn't work, then you go and get an MRI done. So because if somebody comes in, what happens is, suppose somebody comes in with back pain, I'm going to ask them a couple of questions, take the history of how everything started. Have they had back pain in the past? What has their recovery pattern been like? And then we do a few tests that gives us a diagnosis of whether it's a problem with like if it's the spine, is it a problem with the disc? Is it a problem with spinal stenosis? Is it a listhesis? etc., etc. So we rule out the other pathologies, and I know if the nerve is actually being irritated in the back, or is it a local issue. So from my examination, I can find out all that. So once I find out all this, my treatment is going to be on a certain line, right? I know I'm going to do treatment A, B, C, and D. Even if they get a scan done or not, my treatment is going to be the same. However, once I've treated the patient and I feel there's absolutely no difference in their symptoms, or the symptoms have increased, or I feel like I need to know more about what's going on, I'm not very sure, I still need to confirm my diagnosis, I will send the patient for a MRI scan. X-rays have their own place, but usually it's the MRIs, because they are like thin slices of the body that come up in the images. So we are talking like millimeters, right? So X-ray is like one full image, but this is like thin sections cut from the, if it's the spine, if it's thin sections cut through the spine. So I know exactly what's going on in the spine, right? Another place where doctors will tell you to do an MRI is pre-surgery. So if they're going in for a surgery, they want to know exactly what's going on, right? They don't want to cut you up on the table and then find out, oops, there's a lot more going on than what we thought. So that's another way, another place where the doctors will tell you, go get an MRI scan done. Third place where some patients come in and they're very skeptical. What has happened to me? Why do I have this back pain? Why do I have, symptom A, B, C, and D? Or they want to confirm the doctor's diagnosis, or they really want to make sure or have this peace of mind that this is not something that's very dangerous, or it is dangerous, or do I have a tumor there? So some patients are very skeptical, but however, some patients also want to know what's going on, which is fair enough. It's their body, they need to know. So if that be the case, then they go in for an MRI. Sometimes if patients come in with tumors, we usually won't do direct electrotherapy treatment in cases if they have tumor. However, if we are doing anything and for pain relief, but the doctor wants to see what is the progress of the tumor, have they recovered, have they not recovered, then they'll do a series of MRIs or probably CT scan in that case. So this is where, I mean, scans have their own place. It's like medication. You don't want to just take medication for the heck of it, right? You take it when it's needed. And there are times when you really need to take it, you cannot avoid it. Similarly, scans have a time and place. So you don't want to just go and get a scan done just because your insurance is paying for it or just because you want to get it done. So it's got its own place. Your doctor will advise you, your therapist will advise you. Ask your doctor, why do you want me to get a scan? How is it going to make a difference to my treatment? Ask your physiotherapist, is it going to make a difference to your treatment? And how am I better off getting a scan or worse off getting a scan, not getting a scan? So ask these questions and try and find the answers before you actually decide whether you want to go for the scan or not. Because gone are the days where doctor will say, okay, need to get a scan done and this is your form. Go to the lab and get it done. I mean, go to the MRI scan center and get it done. Usually they'll say, okay, let's wait and watch, get your physiotherapy done. If nothing happens, come back and we'll do a scan. So they do give you a bit of time and flexibility nowadays. Most of doctors do. So ask questions. I always say patient education. I can say it till I'm blue in the face. Patient education is vital. Ask questions to your doctor, to your physio. Know why you need to get the scan done. Alrighty. I hope that was useful for you. And if you like what you're watching, and what you're talking about, feel free to join my Facebook group. I will leave a link in the description below. Alrighty, if you have any questions, feel free to ask me. I'll see you guys